My name is Nakali Solome from Group 39. Our proposal is about natural language explanations for malaria microscopy. Malaria is a mosquito-borne infectious disease that affects humans and other animals. Plasmodium parasites are agents of malaria and transmitted through bites of infected Anopheles mosquitoes to human beings. In 2021, Uganda had the third highest number of malaria cases in the world, and it's the seventh highest in terms of malaria death. This map shows the percentage of children who were tested using microscopy who are positive for malaria. Trained microscopes can identify and count malaria parasites, but the accuracy of microscopy depends on the skill and experience, and misdiagnosis can occur due to parasite density, poor blood smear preparation, and observer fatigue. And our aim is to provide healthcare professionals with clear insights into the underlying reasoning, thereby enhancing the effectiveness and trustworthiness of the diagnostic process. About our problem statement, the existing research focuses on accuracy through image analysis and machine learning in malaria diagnosis. However, a gap exists in providing clear, interpretable results. And our proposal aims to improve transparency and reliability of intelligent malaria microscopy and minimize errors arising from inaccurate diagnostics recordings by experts, and most importantly, to improve our foundation, to provide a foundation for clinical validation of explainable AI techniques for intelligent malaria microscopy. Concerning the related works, Plasmodium parasite has 4 virus species, which include Falciparum, Vivax, Ovale, and Malariae, but Falciparum and Vivax are the most common and harmful single-celled Plasmodium species that cause malaria. The following images, they show the way they look like. The Falciparum and the Vivax parasites, Plasmodium. There are 2 main methods for detecting and counting parasites, which include thick blood smear and thin blood smear. Continuing, there are several recent studies have explored the use of artificial intelligence and image analysis for malaria detection. BBeam developed a deep belief network model to identify malaria parasites in red blood cell images, and he was able to obtain a specificity of 95.92%. Also can employ 3 machine learning algorithms, which include logistic regression, decision tree, and random forest. And he to predict the presence of malaria parasites in red blood cells, and he obtained a recall of 86% using random forest algorithm. The following images, they show the normal blood and the affected blood with malaria. Image A shows the normal and image B shows the infected part. Our research contribution in malaria diagnosis, the natural language explanations will help patients and doctors with a deep understanding of how they read malaria slides from microscopes, and this can lead to improved decision-making and better patient outcomes. Our contribution concerning the existing literature, through this research, we shall be able to demonstrate explainable machine learning models in the medical sector, especially in malaria diagnosis, thus doing away with the black box nature of AI predictions. And our future work, they concern with building a responsible system that will provide a path that researchers will follow while handling explainable AI models in malaria diagnosis. About our research contribution, our research objectives and research questions. Our main objective is to develop and implement a responsible intelligence system for malaria diagnosis using machine learning in conjunction with artificial intelligence to generate and provide natural language explanations for microscopic results, thereby contributing to accurate recordings and interpretation of microscopy-based malaria diagnosis. And we shall be answering a question of how can machine learning and artificial intelligence be used to develop a responsible intelligence system that generates natural language explanations to improve the accuracy and interpretability of microscopy-based malaria diagnostics. Our other objectives include to incorporate at least 2 additional language representative of the linguistic diversity in target regions into the natural language processing-based explanation generation module within the first year of the project, and to work with experts to create language explanation for smears or image datasets and provide immediate feedback on the quality of the microscopy samples, offering guidance to users on improving sample preparation for more accurate diagnosis. Also, we want to integrate an alert system to notify healthcare professionals on critical or time-sensitive diagnostic results, enabling swift clinical intervention. About our methodology, our first phase includes raw input. We did raw input of malaria microscopic data containing 1,182 images, and we observed 7,245 objects. We did exploratory data analysis, which involved removing duplicates, normalizing to pixels, and resizing images. We also did data selection and preparation consisting of data labeling and image segmentation. We also split the data into training, validation, and testing data, where test data is used on pre-trained models, which include YOLO V8 and FASTA CNN to perform Plasmodium detection and classification. We did model evaluation using accuracy, F1 score, precision, recall, specificity, and sensitivity, plus confusion matrix to assess the quality of generated explanations. Now our model is a black box, and we want to implement model explainability using explainable AI to ensure that explanations are informative, conscious, and easy to understand. We shall go ahead and generate natural language explanations using Hugging Face transformers, and we integrate them within our models. We shall also do validation and user testing, iterative development, and refine, and finally deploy our application on smart mobile devices. We have done EDA activities on the Makrele AI lab dataset that we are working with, and we obtained this confusion matrix. We found around 34 duplicates, as you can see the results here, 34 duplicates, and we worked with YOLO V8 model and obtained an accuracy of 72%. We are working hard to increase it, and we beat the models in the literature review. We worked with explainable AI models, which include GrandCam and Deep Dream, and we obtained confidence of 81.86% and 88.55%. We used unsupervised learning technique on the dataset with YOLO V8. Concerning the hanging phase, this gave us restrictions on working with explainable AI models. We worked with Lime, Sharp, and GrandCam plus CapTam, and we dropped Deep Dream because it was incompatible and because it is restricted to computer vision tasks only, yet our project is working on both computer vision and natural language processing tasks. As I conclude, one of the most important gaps in the literature review is the researchers not using explainable AI matrices in their models, which would help them identify and correct any biases, errors, or limitations in the models and improve their accuracy and fairness. Our proposal can help to improve the understanding of complex medical images and can provide valuable insights into the diagnostic process as research as research in this area continues, we can expect to see more effective and efficient systems for natural language explanation for malaria microscopy. We express our deep gratitude to Mr. Galiwango and Dr. Rose Nachibule for their outstanding contribution to this research, and we appreciate the Makerere AI Lab for their dedication to advancing research and sharing knowledge as well as the dataset. Thank you so much.